Welcome to Dr. M's 10-part YouTube series over 10 problematic areas that you might be struggling with at home or over a specific length of time. I'm your host, Kia Chisholm. Now today is episode 1 and we are going to be discussing tight pecs, basically your chest muscles. And we're mainly going to focus in on your pectoralis major and your pectoralis minor because that's basically what comprises most of your chest. Now, we need to focus on who gets tight pecs and why they get tight pecs. Now, disclaimer, please do not confuse having tight pecs with having chest pain. If you are experiencing chest pain, you need to call your healthcare provider as soon as possible. Now, back to topic, are tight pecs. Who gets it? People that are suffering from anxiety or high stress bouts. We live in an information age, and so we tend to sit at office spaces. We tend to work on computers, desks. We're still taking hand notes in certain crafts or preferences. And so that means that we tend to hunch over a little bit. And so we're pulling our chest in, and it's getting really tight because it's constrained. When in the reality, we want to be upright so that way our chest has, basically room for it to breathe and be comfortable. Aside from that, because you have people that are also experiencing tight pecs, when they're sitting in this rounded position, we're also assuming that they have some sort of weak back muscles because your muscles aren't pulling you back naturally for you to be able to be in an upright position. But what are some other ways? What are some other examples? Well, ladies specifically, or anyone that wears a bra. If you're wearing a bra that's too tight, you're basically constraining your muscles again, and you're forcing yourself to be in that hunched over position. So you're forcing yourself to have improper posture, and then you combine that with sitting at a desk or taking notes or being on your phone all day, or being on your laptop or your desktop, and it's not high enough for you to be able to sit upright. So when you combine all of these, I guess we can call them factors, we get to a space where, your chest just doesn't like itself anymore. And it's tight, it feels compressed. It might be harder for you to breathe in certain environments. It might be when you lay down, you might feel some sort of relief only when you're laying on your back because your chest finally has that opportunity, basically for it to let itself out and to stretch. But we can either, wallow in this idea of having tight pecs, or we can get to some exercises and some other examples of how you can finally get some relief, starting with at home. So let's walk over here and I'm gonna show you a couple exercise examples. Again, we're working on our back first, because if you have a tight chest, you wanna make sure that you're strengthening the side of your body that's going to help pull those muscles back so you can finally get that relief, that you've been looking for. And so our first exercise is going to be called Superman's. Why? Extremely corny name, but it literally looks like Superman flying in the air. Or you're taller doing some random thing that you find them randomly around the house. So you're gonna get you a nice mat. You're gonna stretch out on it. You're gonna lean down. And you're going to extend your arms forward. You're going to rest your forehead downwards. And the actual exercise is going to look a little something like this. Simple, right? So the idea is to flex the top of your back. You're also squeezing your glutes, so you're getting a little glute work in, and you're going to pull your feet upwards as if you're flying through the air, right? The recommendation, maybe do about 10 reps at a time and do 3 sets, and just do that every day until you can see consistent changes in the strength of your back. Okay, now good mornings is going to involve some sort of a bar or weight. Here, I'm going to be using a 45-pound bar just because I know it's safe enough for my back. But if you have access to a gym, then you can find easy bars, which are going to be shorter bars. On the side is going to tell you the weight of the bar. I recommend, if you've never done these before, to find a 10 to a 20-pound bar, put it on your back, and I'm going to show you exactly what the form should look like. So I have my bar, correct? And I want to make sure you can see the entire premise. So my feet are going to be placed right underneath my shoulders, and I want to stand to the side so you guys can see a better idea. My core is extremely tight, okay? I'm not sucking my stomach in. I'm flexing my stomach so my core can be tight. I'm holding the bar with a very firm and strong hand. And what is going to happen is I'm going to push my hips backwards and I'm going to lean over, almost sort of like a deadlift or a RDL, but it's mainly going to be focused on my back. So I'm going to lean, I'm leaning over, I stop, I lean upwards. Now because I'm more flexible, I want to push myself a little bit more. So I'm leaning, and I'm coming upwards. This is also going to be good for some glute work. Again, working on your posterior chain so you can be tight enough and strong enough in your back to help bring some relief to your chest. And lastly, we have one more exercise before I give you a couple more examples of what you can do. We have rows. So a back row is so simple. I'm gonna show you, you don't have to use a bar for this. You can get some 10-pound dumbbells. I'm gonna show you with a plate. So I have my 25-pound plate, and I recommend starting off with about 10 pounds. You're going to take your plate, you're going to hang it downwards. You're going to pull your chest back. Well, you're going to pull your back, making sure it's nice and tight, nice and flexed. You're going to flex my core, so that way I'm nice and strong in my core. Again, my feet are right underneath my hips, and my hips are in alignment with my shoulders. And for a row, I'm going to bend over ever so slightly to where my hips are leaning backwards, but I'm not pushing myself that much over my knees. My knees aren't coming over my toes. And I'm going to take my weight and I'm going to pull it. There we go. And I'm going to bring it back down. I'm going to use my back muscles. The goal is to get this plate to my rib cage. I'm pulling it up, letting it down, pulling it up, letting it down. And for rows, again, all of these exercises, to be honest with you, 3 sets of 10 reps. A set just means that you completed all the reps at one time, and a rep is every individual motion or every individual completed movement. So I would have 10 of these rows, and that will give me one set. Let's move forward, and I'm going to talk to you guys about a couple physical therapy options that you can use. So what are your physical therapy options? Well, there's a couple. You can have ultrasound therapy for tight pecs. You can also have a deep tissue massage, stem therapy, and the pinch and stretch protocol. Now, ultrasound therapy sounds a little more daunting than what it really is. Instead of using just the heat that you would get from, per se, a heating pad, they add a little bit more heat from the ultrasound machine, and they add it to that specific target area to help loosen up the tendons, the fascia, etc. Now, the deep tissue massage, that's almost as if you're getting a myofascial release. And so everything that's all tight and those cross bridges that won't let go of each other, basically the muscles that are like this, or they're like doing things like this inside of your body, it helps release those, that way they can get even again, your cross bridges can get back into alignment, and you can finally have some relief. Now, the stem therapy, basically, it's like, if you've ever seen a machine where they add like these probes to the body, and it has a wire that connects to a machine, they send electricity, and it helps not shoot it to where it's almost like you're being revived again, as if you died and you needed life. But it is sending some electricity to the body to help jumpstart those muscles and to get them moving again. So that way there can be, so the rehabilitation process can begin. And then lastly, with the pinch and stretch protocol. So for example, they would pinch in this area, and they would ask you to move a certain range of motion. They would let go, you will move again, and they will repeat that process until you get to the range of motion where you get a full stretch. Make sense? Great. Now, the stretches, these are gonna be the most exciting part, and they're gonna give you the most relief. Now, the first stretch that I'm going to show you is so simple. You can do this standing, or you can even do this seated. You're gonna take your arms out, you're going to extend them, and you're literally going to reach back and lean over. From the side, you're going to stretch outwards, reach back, and bend over. I recommend for all of these stretches, give me 5 deep breaths and a good exhale before you actually move forward to the next stretch. The goal is to be able to hold these stretches for about 30 seconds. Now the next one, for all my yoga lovers out there, you're going to basically get to a space where your feet are outside of your shoulders, and you're going to take one arm, you're going to stretch it over, you're going to take this hand and you're going to glide it down. This is to help for your outer pecs and a little bit of your back muscles as well, especially because you're going to be doing all those back exercises, remember? So you're getting this, and then the next variation is to twist out as if you're in a lunge position. My knee is going this way on this side, and my other knee is coming this way facing the camera. I'm going to take this same hand, I'm going to face this way this time, and I'm going to lean. This hand is going to grab onto this leg for support. And the next and the final stretch for us to conclude this video is, well, a chest stretch. And I'm gonna show you exactly how we can accomplish that one. Now this chest stretch, you can do this on a wall, you can do this on a machine or a bar that I'm gonna show you here. But the idea is to simply take your arms, to put them upwards and to fall forward, to really get that nice deep stretch in your upper chest muscles. So you're here, nice and relaxed. Make sure you drop your head. Dropping your head is gonna make sure that you're also getting some stretch in your upper back. And that one might be my favorite of all because it's the laziest. Thank you so much for watching episode 1, which is over tight pecs. Make sure you stay tuned for episode 2 when we're discussing the glutes. Bye y'all, and I'll see y'all soon.